Hi everyone, my name is Shahira and I am a pharmacy student from University Brunei Darussalam. So, in this video, I will talk about diarrhea, which include the signs and symptoms, the causes, what to do when you have diarrhea, and what medicine can you take for the treatment. So first, I will briefly explain what is diarrhea. Diarrhea is a condition characterized by the passing of abnormally loose stools at very short intervals. Then, how do you know if you have diarrhea? The symptoms of diarrhea may include feeling of weakness, sometimes fever, and it also include watery stools that are passed frequently, abdominal cramps, flatulence, or we say it as passing of wind, and sometimes nausea and vomiting. So if you experience any of these symptoms, you probably have diarrhea, and don't worry, usually it will get better after a few days and you can manage it yourself with the management that I will explain later on. And what could be the causes of diarrhea? The causes of diarrhea may vary. It may include, first, a change in the diet. Your diet may or may not be the direct cause of diarrhea, but if you recently have a change in the diet, that could be the reason causing you to have diarrhea. So, you need to avoid food that may trigger the symptoms. Second, food intolerance can also cause diarrhea. It is the difficulty in breaking down certain food, causing unpleasant physical reaction like feeling of fullness, tummy pain, wind, or diarrhea. The most common is lactose intolerance, where it occurs when our body is unable to break down the lactose, which is a type of sugar found in milk or dairy products. If you are not sure whether you have food intolerance or not, you can try keeping a food diary, noting what food you eat, any symptoms you have after eating this food, and when symptoms happen. Once you have an idea of which food may be causing your symptoms, you can try excluding them from your diet one at a time and observe the effect this has. Third, food poisoning is also one of the causes of diarrhea. It can happen if food is not cooked or reheated properly, not stored correctly, for example, it has not been frozen or chilled, the food is left out for too long, handled by someone who is ill or has not washed their hands, and eaten after its use by date. The fourth causes of diarrhea is medication. Taking medicine like antibiotic or magnesium-containing antacids and medication for high blood pressure, such as water pills like furosemide, can also trigger diarrhea. It is common to have diarrhea when you take this medication, especially antibiotics. Many antibiotics will cause diarrhea, however, it will usually clear up after a few days, even without treatment. Next, I will talk about the management of diarrhea that you can do at home. If you have diarrhea, you should drink plenty of water, especially if you have fever. You should also avoid soda or soft drink or other drink that is high in sugar, since it can worsen the condition. And until your condition gets better, try to avoid milk products and food that are greasy, very sweet food, and high fiber, as these can worsen the diarrhea. As for children, give only clear fluids like water. For infants and young children, breast milk or milk feeding should be continued. And lastly, for adults, continue eating the right diet with fluid. Other than that, you can also try one of the products which you can get from the Guardian or any supermarket to treat your diarrhea. So one of the products which you can try is UlphaLyte Oral Rehydration Salt. There are also other brands which is more cheaper, like Oralite Oral Rehydration Salt. So both of these products come with two different flavors. One is natural and one is orange flavor. So, what is the use of this oral rehydration salt? Oral rehydration salt is taken as a replacement of water and loss of ions in the body associated with diarrhea and vomiting. And how should you take it? You should mix with 250 ml of boiled cold water to the content of 1 sachet and stir or shake well for 2 to 3 minutes to dissolve. And when do you take the oral rehydration salt? You should take it after every loose bowel motion when needed. If nausea and vomiting are present, and in infants and young children, drink the solution slowly in sips at short intervals. Any unused solution should be discarded no later than 1 hour after preparation unless stored in refrigerator where you can keep the solution up to 24 hours. So how do you store the products? You should store in dry place below 30 degrees Celsius and avoid from light. Also, keep out of reach of children. In case you are wondering how 250 ml look like, here are example of a cup and a bottle of 250 ml. So when should you see a doctor? If you still have diarrhea after 2 to 3 days of treatment, I suggest you to see a doctor. And if you happen to have any of these symptoms like severe vomiting and fever, recent travel abroad, suspected reaction from taking medicine prescribed by the doctor, presence of blood or mucus in the stools, and any sign of dehydration like dryness of mouth, thirst, and decreased urination, you should seek medical advice immediately. Before I end this video, I have prepared some questions for you from what have been covered in the video. So for the first 3 questions, you need to decide whether the statement is true or false. So first statement is, diarrhea can be caused by lactose intolerance. Second, you should take sugary food and greasy food when you have diarrhea. And third, if diarrhea is still present for a week after treatment, you should just wait for another days until it gets better. And for the next questions, what is the name of the product that you can take for diarrhea? How do you take them? And when do you take it? You can pause the video now. Okay, did you manage to answer all the questions earlier? Now, let's discuss the answers. So for the first question, diarrhea can be caused by lactose intolerance. This statement is correct. Second, you should take sugary food and greasy food when you have diarrhea. And this statement is false because you should avoid this food as it can worsen diarrhea. And third, if diarrhea is still present for a week, you should just wait for another days until it gets better. So this is also false because you should see a doctor if diarrhea is not getting better in 2 to 3 days after treatment. And for the next questions, the answers are, the product that you can take for diarrhea are UlphaLyte oral rehydration salt or Oralite oral rehydration salt, and you should take it by mixing 1 sachet with 250 ml of boiled cold water and take it after every loose bowel motion when needed. So I guess that's the end of the video. I hope you learned and gained some information about diarrhea, and thank you so much for watching.